Hi, I'm Dr. Gordon Ko. I'm a medical director for the Canadian Centre for Integrative Medicine. I'm a specialist in physiatry, which is physical medicine and rehabilitation. Well, the biggest innovation in dystonia management has been really correcting the root causes of dystonia. This starts with looking at the neurological cause of dystonia, which is the hyperactivity from the central nervous system implicated or showing up in the muscles being really tight. The greatest unmet need in our patients with cervical dystonia is getting properly diagnosed. The average patient has their symptoms for over 5 years, seeing over 3 different medical professionals before they even get the appropriate diagnosis. And the earlier that we're able to get diagnosis and treatment going, the faster we can resolve a person's chronic condition before it really starts to affect their quality of life. I've been treating cervical dystonia and other neurological conditions for over 25 years. I have patients that come in, they're not able to function. They'll have these neurological pulling of muscles. We have our patients do their physiotherapy. They have to strengthen their muscles, improve their posture, look at the ergonomics of their chair, how they're doing their work, how they're sleeping. I put a big emphasis on also eating properly and handling the stress components as well that could drive symptoms. We see major improvements in a patient's ability to do basic things, like being able to dress themselves, like being able to do work and use a computer, read a book, drive a car. These are significant things that really make big changes with their level of function and quality of life. A 50-year-old radiology technician who had developed really chronic neck pain for over 8 years. And it wasn't until we finally diagnosed her with cervical dystonia that we were able to get her back to really good quality of life. And she not only had the tightness in the neck muscles and pulling of the shoulders, but she also had really some bizarre dystonia movements as well going into the arm that really interfered with her ability to even lift things. We started the treatment using an integrative model with allied health professionals who work closely with me, a specialized physiotherapist. She returned back to full-time work and activity. She was back exercising in the gym. She was doing all the activities that you'd expect someone of her age to carry out at home with her pets and with her family. That's like a classic example of patients of ours that have done really, really well. And the nicest thing that I see when they come back for a follow-up is that big smile on their face when they say, "Doctor, you've really helped with how I'm moving and how I'm able to function, and my pain is so much better." What excites me about the future of dystonia management is this whole field of neuroplasticity. So there's the concept of deep brain stimulation that can be helpful, but there are less invasive procedures like the translingual technology that can be applied to the tongue, combined with exercise rehab to help with dystonia management.